Hello, and welcome to COVID-19 Right Now from the Yale School of Public Health. I am James Hamblin. I am a lecturer in health policy. It's June 18th. I am joined today by two guests, and we're going to be talking about primarily coronavirus in Russia. And I also have a fire alarm going off where I am, and you'll have to ignore that, so I'll keep this brief. Judyth Twigg is a professor of political science at Virginia Commonwealth University. Thank you for joining, Judy. I should also say that I have been alerted that the fire alarm is a test, so don't worry for me. And joined again by Robert Heimer. He's a professor of epidemiology of microbial diseases at Yale and our first repeat guest. Thank you for coming back, Dr. Heimer.
Thank you for inviting me back. I guess I didn't do terribly last week.
No, it was a great conversation. And as always, if you are watching this live and you would like to throw a question out there at any point, please put it in the comments and we will do our best to address it. Okay, in traditional form for this show, I like to, things are changing hour to hour, day to day, and I'd like to know whether it's Russia related or not, what is at the front of your mind at just this moment as the primary concern about what's happening with COVID-19? And Judy, if you could go first as our new guest.
Sure. So I'll just give a brief lay of the land of what's happening with COVID-19 in Russia, because if you look at the numbers that are presented by the Russian government, it looks like a country that's handled the pandemic fairly well. They have about 550,000 reported cases. That puts them at number 3 in the world after the United States and Brazil, and a remarkably low reported number of deaths, about 7,600 deaths at this point. So I'm sure we'll want to come back to that and interrogate those numbers a little more closely. What's most interesting to me at the moment, looking at the course of the epidemic in Russia, is the way it's moved from being Moscow-centric in the capital out to the regions across Russia. Coronavirus came into Russia through Moscow as a handful of rich Russians who had been on ski vacations in Western Europe that brought the virus into the country. And we saw Moscow early on bear the brunt of the burden. At its peak, about half or even 60% of the daily reported burden of new cases was in Moscow or Moscow Oblast, the region just surrounding Moscow. And at peak, they were reporting 10 to 11,000 new cases every day across the entire country. That was back in the first couple of weeks of May. Over the last couple of weeks, they've gone down to a steady plateau in the neighborhood of 8,000 to 8,500. It seems weeks cases in Moscow, which means that proportionally the burden is starting to hit in the regions across the country. Moscow had a healthcare system that was way better equipped in terms of money, personnel, expertise to handle this. So we worry about what's happening as it spreads out to some of the less well-developed, well-prepared areas.
Right. Yeah. Okay. So you're seeing a sort of this is going to interact with populations in different ways, depending on healthcare system preparedness, population density, all sorts of different things. And
demographic factors, those populations are older and sicker outside Moscow.
Yeah. Well, let's just jump right into Russia in this discussion, unless you had something else you wanted to throw out as at the top of your mind, Dr. Heimer, before we do.
No, I think Judy sums up the situation very nicely. I think the other thing to understand is just how, in some ways similar, what's going on in Russia is a mirror of what's going on in the United States.
Yeah.
You have an epicenter that is created by international travel, whether it's New York or Moscow. You have a large rate of new infections in those centrally located epicenters, and eventual diffusion to other places in the country if you don't have a travel ban or lockdown. It does not take, from what we're learning, very many super spreaders or very many unfortunate congregate activities to produce a massive spread of this coronavirus. It appears to be remarkably contagious.
Yeah.
I think that, obviously the leaders of the two countries are very worried about it from their own personal health standpoint, but don't seem to be as worried about it from the standpoint of the health of the populace they're the leaders of.
Yeah. All right. I would like to ask about specific recommendations for kind of travel restrictions internationally and nationally and how we could guide those things. But let's get to that and, later on. And right now start with kind of the baseline. I'm very focused on covering the US. So it's great for me to have a broader lens of the rest of the world and what is happening. Russia specifically is a blind spot for me. Judy, you mentioned the reported numbers there. How confident are you that what you're seeing is reflecting, isn't reported, how much testing is going on, how many people have access to healthcare? So do we really think that Russia is the third hardest hit country in the world?
So I'll kick the epidemiology part of that question over to Robert, the epidemiologist, but I'll handle it from my lane, which is the politics part. And just note that there are all kinds of incentives baked into Russia's power verticals, its bureaucratic and administrative incentives, where it's not a good idea for someone on one of the low rungs of the ladder, one of the bottom elements of the administrative or bureaucratic food chain, to be the bearer of bad news to the boss. And so there are expectations built into that. You'll tell the boss what the boss wants to hear. And in most cases, that is good news about something politically sensitive like a major pandemic. And questioning is not some grand, insidious political conspiracy where Putin knows, the real numbers and that he's sitting there with two sets of books in the Kremlin, one the truth and one the lie that he's spreading out to the rest of the world. I don't think that's what's going on. I think it's much more subtle than that. Part of it is these political and bureaucratic incentives to report up good news. And then part of it is how they classify causes of death, which I think Robert's much more competent to talk about than I am.
And I just offer possibly that incentive structure, we've seen that happen. It seems at the beginning of the outbreak in China, where there's at least incentives for people to say that things are better than they are. And also in the US, where there were certainly a health official at the podium in press conferences and sort of alluding to the fact that things could get very bad while also saying, everyone's at low risk and touting that we only had 15 cases or so. So it's a phenomenon that's kind of universal, but that's really interesting. What do you think, Dr. Heimer, of...
I think the data manipulation we have seen emerge sporadically in the United States over the past several weeks is probably more egregious than the data manipulation in Russia. I honestly don't think that the Russians are undercounting the number of positive tests they're getting when they test people. Russian bureaucratic system is very, very good at numerators. They count extremely well and extremely thoroughly in many cases.
Yeah.
What Judy was alluding to in terms of classification error is really occurring at the level of the reported deaths. Russia is unique in the world and having a death rate among coronavirus at around 1%. Everywhere else in the world, it's 3, 4, 5, 7, 8. In places with an elderly population, like Italy, it can be even higher. What the Russians have is a healthcare system and a public health reporting system that is very different from much of what you see in the rest of the world. And one of the big differences presents itself in how they report out causes of death. They report out the most proximal cause of death. So if someone dies from a cytokine storm and their kidneys shut down as a result of coronavirus, they will be reported as a death due to renal failure. If their lungs fill up with fluid and they have a pneumonia, it'll be reported as pneumonia. If they have heart failure, it'll be reported as heart failure. It doesn't mean the coronavirus wasn't involved. Externally, people have gone to the effort of looking at, to get a more accurate depiction of the situation, by looking at excess deaths that were occurring in Moscow in March and April and May as a result of coronavirus, comparing the number of reported deaths, which, as I said, the Russians are very good at counting, comparing those months of 2020 to 2019 and 2018. And it was clear that they were undercounting the number of coronavirus, or the number of excess deaths suggested that they were undercounting coronavirus-related deaths by about a factor of 4, which would put it in the range of about 5 to 6%, which is just about right for the age of the population and the sophistication of the Moscow healthcare system.
Yeah. Okay. Just a kind of best practices question on reporting deaths. You can see that if someone does die of renal failure or any number of complications that can come from COVID-19, do we need a global standardized way of saying, okay, maybe COVID-19 was not the only thing, but we can specify it was something due to COVID-19?
Wait, we don't even have a standardized system in the United States for that.
I know. Yeah.
So why are you even?
I'm in solutions mode. I'm asking what we should be doing. What's an ideal but as an epidemiologist, what would be most useful to you? I mean, we also do need to keep track of what is the ultimate end cause of death, and we also want to know to what degree COVID is involved.
It does seem that the efforts to use the metric of excess deaths is a good way for us after the fact as epidemiologists to get the full picture of the severity of the epidemic. That can be done in almost real time, but not quite real time. And deaths are always going to be a lagging indicator. After all, if you're infected now, you're not going to be symptomatic for 5 days or a week. You're not going to be seriously ill and hospitalized for 2 weeks or more. You're not going to die immediately. Well, some people do, even before they get to the hospital, but many of the people are going to be sustained on life support in the hospital for a long time before they die. So deaths are always going to be a lagging indicator.
Dr. Twigg, what sort of new issues present themselves as the virus moves from Moscow out into more rural areas?
More broadly, I think it's important to think, and I'm struck by the comparison between Russia and the United States here, to think about the political pressures that are motivating premature reopenings of the economy and society. In the United States, obviously, we have a president who is obsessed with his image, obsessed with his reelection prospects, and he's clearly giving green lights and encouraging reopenings in ways that run counter to what the public health professionals would tell us is appropriate. In Russia, it's that situation on steroids. Kick it up an order of magnitude, because this spring was supposed to be something of a triumph, a coronation for Russian President Vladimir Putin. He was scheduled on April 22nd to have a nationwide referendum on amendments to the Russian Constitution that would allow him to run for re-election 2 more times and potentially keep him in office until the year 2036. And he was also then supposed to cap that with a huge set of celebrations and parades in Moscow and around the country commemorating the 75th anniversary of the victory in World War II, the Great Patriotic War, as they call it in Europe. Now all that's been postponed. And what Putin has found politically as the pandemic has progressed in Russia is his approval ratings, his trust ratings, his overall popularity ratings going down, and an increase in some of the popularity ratings of some of the regional governors, like the Moscow mayor, some of the other heads of the regions. And so Putin has now rescheduled this big nationwide vote that's going to involve people going to polling places, gathering in groups in public spaces for the last week of June leading into July 1st. They're going to go ahead with their big parades at the end of July. They're really pushing the envelope of what's okay with public health because Putin wants to get this vote and cement his constitutional amendments in place before his political situation erodes any further.
Wow. So, Dr. Heimer, that sounds like a sort of worst possible case scenario for things to get really bad in Russia in coming months. And is that?
Yeah, especially since what we're seeing is absolutely no attenuation in the number of new diagnoses. So they have not really succeeded in blunting the curve or flattening the curve to any substantial sense. And as Judy's already mentioned, the diffusion into the other regions, certainly in some of the other major cities, Nizhny Novgorod, St. Petersburg, suggests that the spread outward is going to continue, is that the disease is really reaching the point with that many cases a year, going almost to an endemic state. And it's, where it's just part of the background of everyday life because it hasn't been eliminated at an early enough stage. I think what you're seeing and what you're going to see, if there is this election, if it isn't postponed yet again, is going to be this is going to be seen as this period of time when we're seeing 7,000-8,000 cases, daily, is going to be seen as a breathing room between the first peak and the second peak, which was exactly what we saw, decades ago, 2 decades ago now, with the HIV epidemic in Russia, which had exactly the same kind of structure in terms of an early burst of cases, then an initial lowering, and then a second, level of infections that made the first set of infections look small by comparison. And I think reasons for it, are exactly the same, that Russia is a country where good news is appreciated and bad news is buried.
And James, you mentioned a moment ago questions about how the healthcare system will cope with the shift in the burden of moderate to severe infection moving out into the regions. Moscow handled things fairly well. Like New York, there was some serious stress with the early surge, but they were able to mobilize. There was surge capacity in place. They converted existing facilities to COVID-19 treatment facilities. They built a lot of new capacity very fast. They brought in the Ministry of Defense and deployed military medical capacity. So far, Moscow's looked okay. But just in the last couple of weeks, there have been quite a few disturbing reports out of St. Petersburg, which is also a big, modern, well-developed urban center. And yet we're hearing stories about hospitals in St. Petersburg turning away 100 or 200 patients because they just don't have space. If St. Petersburg doesn't have capacity to deal with this level of new cases, it's worrisome to think about what's going to happen as this moves out into the other larger cities, and then if it gets into some places with less population density, but through hotspots like we've already seen in care homes, oil and gas production facilities, dormitories, hostels for migrant labor. There are all kinds of places where we've already seen high caseloads spring up, and healthcare facilities are not equipped to handle it.
Yeah. Dr. Heimer, at a global level, is that, it seems like in properly rural areas, there is some effect of distancing that will at least not allow a massive surge at the same time. But does it seem like the highest risk areas are going to be high population density, low, not much development in terms of healthcare system, sort of probably lower socioeconomic status?
Well, I think
dense areas.
Yes, I think you're going to see relatively large outbreaks in the in all of the urban centers, in the in those industrial cities, which tend to be cities of smaller sizes that are scattered around the country, where, you know, to exploit the natural resources of the country, you know, those conditions in many of those smaller cities it's been neglected since Soviet times, and those are going to be hotspots where, although they won't necessarily contribute as many cases numerically, because those cities are smaller than the 5 million people in St. Petersburg or the 2 million people in Nizhny Novgorod or whatever, you're going to have high prevalence within those smaller populations. And since those smaller cities are also magnets where people in the more rural areas go to shop and take care of other business, you're going to see eventual spread out to the rural communities. The interconnectedness of the Russian system, which has been centralizing, for a couple of centuries now, is such that the countryside requires the cities and towns, and no one is immune. Obviously, the rate at which it diffuses is going to differ from location to location, but it's going to spread fairly remorselessly.
Right. And speaking of the political incentives for this coming election in Russia, we also have the presidential election in November. We have a president who's holding an in-person rally this weekend, and foreseeably things could ramp up, especially if we get a fall wave in the US in the way that some people are predicting, for things to get really bad right around the time when Trump would have every incentive to bring people out to rallies and pretend like things aren't as bad as they are. Do you foresee, this is to both of you, first to Dr. Twigg, do you foresee the same forces coming to some degree into play around November in the US?
Certainly in the US, yeah. I mean, there's not a similar situation with electoral timing in Russia as we have here in the United States. But you talk about the parallels between the United States and Russia. There was a piece in the Washington Post 2 or 3 weeks ago that talked about the coming spread, just as Dr. Heimer described, the coming spread of the epidemic to rural areas in the United States. And it talked about a couple of the factors that Robert just listed, also the greater vulnerability in rural areas because of demographics, because of pre-existing morbidities, because of the prevalence of care homes, because of poor healthcare systems in rural areas. And I was struck when I read that piece about the United States in the Washington Post, about how accurate it would have been just to do a search and replace for the United States and Russia, and you could have told the exact same story about what's coming in Russia.
I always joke that these are two countries separated at birth. Politically, the sense of self-worth as a special nation, unique on the planet, that outsiders can't really understand, so don't bother to try to understand us. It's the more time I had spent in Russia, the more this parallel has struck home and allowed me, in some ways, to better understand Russia through the lens of an America that has so many parallels.
Yeah.
I do want to say that I think the notion of a second wave in the fall is now a misnomer in many ways. that much of that idea was predicated on coronavirus acting like the flu and disappearing in the summer and recrudescing. It's not going away. It's a virus that is remarkably not sensitive to the perturbations in the normal weather system. If you can have outbreaks in Amazonia, if you can have outbreaks in the Arabian Peninsula, where the temperatures are hot and in one place very humid and the other place very dry, or in Arizona now and in Florida now, again, the difference between humid and dry, this is not a virus that's going away this summer. So we, and since both countries are doing very little to curtail the spread through effective public health interventions and economic interventions, we're not going to see a second wave. We're going to see a very prolonged and perhaps increasing first wave. And even when that first wave is done, who knows when, we're going to get out of this when we have effective either treatment for people who are infected to, prevent them from, early on getting sick, but even more important, a vaccine that prevents them from getting infected in the first place. Right. And until then, I'm worried, and Russia, like the United States, is rushing a vaccine to market. They started the first vaccine trials in Russia just this week with army volunteers, or volunteers in quotes.
I should clarify, when I've heard people predict that things could get even worse in the cold weather, I think that partly is at least just due to human behavior. Especially in New York, people are able to get out and go to parks. We were talking about Prospect Park, and when things are colder, at least people will be in closer proximity. Do you think that has any validity to it, or is that
all depends on the density people allow themselves in Central Park and Prospect Park, which apparently, according to Cuomo and de Blasio, is getting out of hand already.
It's better than I think a lot of the news makes it out to be, but I think closing it down, I don't know what people would do then. They'd leave the city. I could talk endlessly about park systems. We have, I did want to follow up on the vaccine. Is there anything, rushing a vaccine to market? There was a recent poll that in the US, about 49% of people said that they would get a coronavirus vaccine. Just a simple question like that, about 49%. So you have a lot of people who are already going to be vaccine hesitant, or simply not want to trust something that comes out if it feels at all rushed or not transparent. I got to imagine that number is going to go down. Are there lessons from Russia politically about trying to make that process work at such an accelerated rate?
Don't know about Russia, but certainly at this point, with anti-vaxxers having a megaphone, if we rush a vaccine to market that ends up having substantial side effects once it's brought to market, it will be a disaster for the vaccination effort, plain and simple. And that's true in the US, it's true in Europe, it's going to be true in Russia as well. The same anti-vax messages are spread in Russia by Twitter and Facebook and Vkontakte, the Russian equivalent of Facebook, the same way they're spread here.
And it's important to note, I think, that Russia is the source of a pretty good handful of that health-related disinformation. And it is true that with vaccines, and then most specifically with COVID-19 as well, much of that disinformation has come back into the Russian information ecosystem. It's come back to bite them.
Right. Do either of you think that you have a sense that transparency could help this? Are we being transparent enough with the vaccine development in the US? Has Russia made efforts to try to preempt that skepticism that they know they're going to encounter?
It looks to me like this global race to be the first with the vaccine has become highly politicized, and Russia's definitely playing that game. They want the prestige of being number one to bring something to market.
And on the other hand, in the US, our vaccine czar is basically going back to his previous activities, which in some ways I guess is good since he's so connected to the pharmaceutical industry and the vaccine industry, that his being in charge might only have led to more corruption and internal irregularities. But certainly there's now no one in charge at the federal level of that effort anymore. So who knows what's going to happen as these different companies do rush their product to market.
Neither of you is leaving me with a lot of hope. We have a couple questions from viewers. I think we have time to get to one of them. Can you talk about status of contact tracing in New Haven or Russia? So is Russia having any success with contact tracing, or any hopeful lessons to be taken away from things that have worked?
I don't know. I answer
Okay.
to. I'm sorry. I don't see contact tracing here as having been particularly effective.
Russia has set up elaborate information technology systems, not just in Moscow, but in quite a few areas around the country, with apps where people are required to check in. There's extensive, in Moscow and some other places, video surveillance systems with full facial recognition having been set up. I have to mention that just the other day they announced that they're going to take some of that facial recognition video technology and deploy it in Russian schools, and they're actually formally calling that system the Orwell system. Yeah. So they've got the tech in place. It hasn't always worked as planned, and I don't get a sense that they've been particularly successful at deploying it specifically for contact tracing.
Okay. That's our time. We should probably wrap up. Is there any final thoughts that either of you wanted to make sure that we mentioned? Because we've had a kind of sprawling conversation here, and there's lots more to say, obviously.
I did want to mention one thing very quickly, and that is that a large percentage of the cases of people who are dying in Russia are members of the healthcare system, especially doctors. I think 6 to 7% of the deaths attributed to coronavirus have been among physicians in Russia. So their healthcare system is being damaged at the same time that they need it to operate on all cylinders.
Well, do you have a sense of why that's happening?
Some of it is the absence of PPE, personal protective equipment. Some of it is the absence of early enough instruction about proper proper hospital, sanitation and safety and disinfection, and I think it also comes from sort of a Russian doctor's traditional belief in their own, that somehow their own moral and intellectual superiority will protect them from the ills of society.
Let me segue that into maybe a bit of a bright spot to end on, since you were looking for that earlier. It's been remarkable as the community of doctors and healthcare workers has been so severely impacted, the extent to which they have mobilized. Very vocal doctors' unions, healthcare personnel, speaking out on social media, speaking out in Russian and international media. And I think that's just one part of an incredible mobilization of civil society that we're seeing in Russia as a part of the response to COVID-19, not just doctors, but people from all walks of life coming together, as we've seen in all parts of the world, to provide basic support and social services in the vacuum that's been created by government inaction. And much of that is blending into the political now. So it's going to be interesting moving forward to see the extent to which this new energy, and there's always been good, brave energy in Russian civil society, but it's become even more energetic and prominent now, whether this starts in the medium or long term to have an impact on the quality of political discourse and the quality of Russian so-called democracy, whether we start to see a movement toward more responsibility and legitimacy of civil society and non-governmental institutions.
So there's at least some hope there that good things are happening and more good things may in the future. It's helpful to be reminded that everybody who's out there working and following this and contributing to public health in all sorts of different ways, it's a really important moment for that. Dr. Heimer and Dr. Twigg, thank you so much for joining me, and everyone who watched. We will see you again next Thursday. Thank you.
Thank you for inviting me on.